If you feel like you are stable and just need your meds, then now I would take that step forward into the Betty Hardwick side if you're needing that support and resources.
That's Will Claxton. He's a police officer in Abilene, Texas. You just heard him on the phone talking to a local resident.
That being said, we'll probably come check on you next week, okay, and see if you've kind of got that ball rolling, all right? See if we can't help you out.
As a police officer assigned to our community response team, I kind of break down that wall of what a traditional police officer would do.
Will was part of a community response team to help respond to mental health calls from folks in the community. The team is made up of a police officer, a crisis worker, and a paramedic from the fire department.
We got
Vargas.
We usually come in the morning and kind of review the calls from dispatch that we get from the night before.
That's Andrea Reyes. She's a crisis worker on the community response team. She works to stabilize community members who are experiencing a mental or behavioral health crisis and quickly get them the care they need.
Our goal is to keep people that are really mentally ill out of the ERs and keep them out of jail.
There was a disturbance over some Cool Whip. She wasn't seen by crisis.
Did they call fire or no?
No, fire was not there.
Josh Horelica, who you just heard, also served on the community response team from 2021 to 2023. He's a paramedic for the Abilene Fire Department.
I medically clear patients or clients. If there's scrapes, bruises, I bandage it. But there's a need that's been pressing that hasn't been talked about or hasn't been seen. Mental health has become an issue that just can't be overlooked anymore.
Welcome to After the Fact. For the Pew Charitable Trusts, I'm Dan LeDuc. In the United States, police officers, jail officials, and emergency room physicians are often the only people on call to respond to people in crisis. Oftentimes, they don't have the right training to handle mental health or behavioral health calls. And as a result, people with mental health conditions are jailed more than 2 million times each year. But communities across America are changing this narrative by trying something new. They're creating crisis response teams. The teams are made up of professionals like social workers, firefighters, and even police officers who are specially trained in mental health crisis response. They work to help meet the needs of residents, keep folks out of jail, and reduce the strain on law enforcement. This is the story of one of those teams.
We are in Abilene, Texas. We have crime, homelessness, but we also have everything else you'd want. Family, friends, it's home.
Abilene lies just on the edge of West Texas, and with its shopping and restaurants and large hospital, serves as a connection hub for surrounding rural areas, known as the Big Country region. It's the kind of town where neighbors wave hello when they pass each other on the street, and people can get where they're going with no traffic. Locals look forward to the annual rodeo every fall.
We know that over 2 million Americans with mental illness are arrested each year, usually for some low-level offense, misdemeanor level.
You're hearing from Julie Wertheimer, who leads the Mental Health and Justice Partnerships Project here at the Pew Charitable Trusts.
We've seen an increase in the number of people who have experienced some sort of mental illness or behavioral health crises, whether we're talking about substance use disorders or people experiencing co-occurring substance use and mental health disorders. And we know that law enforcement is not the most efficient way to respond to those incidents, those crises. So it's been long overdue for a change.
Everybody's aware of the national narrative that police encounters with people in mental crisis usually don't end well for either side.
That's Lieutenant Brad McGary, also from Abilene. He helped start the community response team back in 2019.
What we've tried to do is make our response less about a law enforcement response and more about the crisis response. They are truly looking at it from a facet of what does this person need and how can we deliver it?
Every law enforcement agency across America is dealing with mental health.
That's Officer Will Claxton again.
I think that more people are trying to readjust how police are responding to those calls.
Will was promoted to a different position within the police department after we recorded these interviews. But when it comes to community response, he's not alone in his thinking.
When you talk to police officers, sheriffs, we've seen an increased awareness that law enforcement is not the appropriate response to these health crises, but can be especially detrimental to Black and brown communities.
We're not just talking about race and why it matters, but it does.
Yolanda Lewis is the Executive Vice President for Justice and Health at the Meadows Mental Health Policy Institute. The organization worked to help form the community response team in Abilene. She's also a former colleague of mine at Pew, where she directed our safety and justice portfolio. Pew and Meadows work together closely on mental health and justice issues in the United States.
My former experience as a practitioner has really kind of shaped the perspective that I have on research and how it applies to the criminal justice system.
In her past work as the district court administrator in Atlanta, she designed plans to help improve public safety with a focus on mental health and justice reinvestment.
There is a need to provide evidence and information that truly represents how the system affects people in the name of public safety, and then how it becomes a continuing case study for the need for deeper reforms.
We have a client that you have to speak to him in third person, and if you don't talk to him in third person, he won't respond.
We're back with Andrea Reyes, the mental health crisis worker on the community response team.
Officers that aren't familiar with him or don't know him, they try to have a conversation with him. There was a situation at a gas station one day, and they were telling him he needed to leave, but they weren't talking to him in third person, so he wasn't listening. It was to the point where they were almost going to tase him.
As a police officer, if someone's in crisis, we just kind of get a quick little snapshot.
The community response team came in and we were like, hey, we know this guy, let us talk to him. We were able to get him out of the gas station and the other officers were able to leave. But I mean, it was going to end badly.
And what did emergency services for a mental health crisis in Abilene look like before the community response team? Jenny Good tells us more.
Meadows Mental Health Policy Institute came to our community and did a needs assessment called a Smart Justice Assessment.
Jenny is an Abilene resident and CEO of the Hardwick Center, a local organization that helps treat adults and teens who are experiencing mental health challenges. She helped start the community response team in Abilene.
They took some data from the 911 centers and made a determination about how many of those involved behavioral health services. We took that data and made some determinations about the challenges that our agencies were having in responding to them.
Before the CRT units were built, an officer would go out, they would contact the mental health authority who would send out a crisis worker. If it was going to be inpatient, they would have to try to find a facility that had a vacancy.
Just being an officer when I first started, if someone's having a mental health crisis, you would respond, make sure it's safe, call Betty Hardwick.
Prior to the community response team, I was the crisis team leader here at Betty Hardwick. We covered 5 counties. Sometimes there's just one worker. So if we're an hour and a half away, then we have 2 police officers on scene waiting for a crisis worker to respond.
And so that whole time, the officer is basically, okay, I'm done with what I have to do, but now I'm just kind of here waiting to see what's going to happen. Officers would get tied up for hours with a mental health patient instead of answering burglary calls and things that were more law enforcement specific.
Initially, they were going to call it the CRT, the crisis response team. But then we got to thinking, we don't want to just respond to crisis. We called it the community response team so we can engage with people in the community.
The city saw early results from its community response teams. In 2020, teams responded to 1,651 mental health calls in Abilene. Those responses prevented 58 emergency room visits and 33 jail bookings, which is significant for a population of 125,000.
She called last night. She was drunk, said that she was going to take a bunch of pills.
I saw that, but then denied medical.
Yeah. So that may be someone that we can just follow up with today.
You're putting a lot of alpha type personalities in the same vehicle for 10 or more hours a day, going from one crisis to another crisis to another crisis. You're following up with people that were previously in crisis.
We also listen for 911 calls of suicidal people or possibly sometimes injured subjects or just disturbances.
How were you last week? I didn't get to talk to you.
felt really depressed.
What happened? Depressed?
Sometimes it's extremely stressful. Sometimes they want to bang their head on the wall.
That the neighbor's gonna shoot him with a gun, that the calm party is gonna grab his machete.
We do go into dangerous situations, sometimes unknowingly, sometimes knowingly. People can be very unpredictable.
They said they left you a food box. Did you get it? Kind of know brought it. You want Josh to check your vitals? No, but
You kind of know what to look for in terms of, schizophrenia, bipolar, but actually seeing clients on a daily basis and up close and personal, it definitely helps.
please, because this is it. 4 months, or you ain't getting no new body, no new life, and no next life. I won't give it to you.
Well,
right.
holler at you later, okay?
See you later, okay?
Need something. We're being invited into these people's houses on the worst day of their life sometimes, and it's like having to be the calm to their chaos and try to tell them that we're going to take the best care of them or their loved one. We're in Texas. People have guns. There's weapons.
I come out this way so the vicious dogs don't attack y'all.
Sometimes my cop will say, hey, we need to move this situation from talking to them in their house to let's talk to them on the front yard or outside.
But we're gonna have to roll out of here, okay? We just wanted to stop by and check on you.
As a police officer, I am security. We don't make decisions alone. We don't go to a call and I show up and say, hey, we're gonna do this, and that's the way it's gonna be. We discuss all of our calls as a team. Sometimes they may have not had the best interactions with law enforcement in the past, and so coming in there in this team aspect, we can kind of bridge that gap and rebuild it.
You're lucky to me. I never win when I go. I never win. Every once in a while.
There's a lot of people that are hesitant about mental health. We have been cussed out many times, and we continue to go back. And it's just about letting these people know, like, you can cuss us out, that's fine, but we're still going to show up.
See your clinic appointment? Oh, yeah. December 5th? That's good. December 5th. December 5th.
Paws are a bit orange. The scales here are more orange too. And the eyes are orange. Yeah, it's definitely speedy. And that is how you tell the sex of a box turtle. Orange, think a man with a tan. Man rhymes with tan. So
I would say that I look forward to seeing Grant, hopefully as much as he looks forward to seeing us.
Grant is an Abilene resident that the team checks on regularly. He lives with his dad and struggles with his mental health. Before the community response team, Grant would often make noises in the street when going through a mental health crisis, and neighbors would call the police, and he'd end up in the hospital.
Grant, he's a good guy. We met under unfriendly circumstances.
People would often call in on him because he would be in the street.
He often has suicidal thoughts. He wants to run out into the road and get run over and just be done. And it's all over people just being mean to him online.
you've spent as much time on the internet as I have, you've become very cynical and hateful.
And so we've built enough relation to where he trusts us and trusts our opinion, and showing him that not everybody's perfect and not everybody online deserves your time. Some people are on there just to be mean. He makes puzzles that are nationally recognized by puzzle magazines and puzzle enthusiasts.
He's actually working on putting a puzzle together to see if he can stump us.
Have you been working on your puzzles?
Yeah, I'm working on those.
Did you get ours yet?
I guess it slipped my mind, but I'm gonna send myself an email reminder.
I'm ready for it. I'm ready.
See if you can stump us.
I'm ready to do the Grant puzzle.
If he is in crisis, I can call Grant on the phone and I can talk to him for 10, 15 minutes and change his mood completely and put him in a better place.
Voluntary Christian Service Center. I don't want to say it changed my life, but it certainly changed my past day or so, and I want to keep it up.
Yeah, absolutely.
It just, I don't know why, but being surrounded by that environment.
He's excited about volunteering at his church and, helping Meals on Wheels and just using his existence to be the better for other people.
The community response team, they keep me in check and give me advice.
It's just him and his dad, and so I think a lot of times Grant gets lonely, and to be somebody there that he can talk to and to come see him and show compassion and let him know that we care, I think it helps him.
I was at the point I didn't know what to do for him.
That's Grant's dad, Gary.
He run out and tried in the street and in front of cars, and I didn't know what to do. I can't run very fast because I had a broken hip, and I'm really Thankful for them, for what they're doing. Abilene's lucky to have them.
I've learned a lot that the books really can't kind of cover. Kind of just almost treat it like it's not a thing, if that makes sense. You know, kind of humanize it. You know, talk to people, look at them in the eyes, try and empathize and feel what they're going through.
It's feeling a lot better. I want to make it a habit to volunteer my time more.
Absolutely. And I think you're doing a good job there, Grant.
That's good, Grant. My ulterior motive is to get out of the house and get out of my mind.
Hey, and getting out of the house is great too. Remember, we talked about that a lot. You know, we talked about walking on days like today, just going for a walk.
So for me, when you're an officer, most situations you're taking people to jail, and now I get to keep people out of jail. That's pretty neat. You know, we'll go to calls and that person.
You're hearing Will again. He, along with other community response team members, are speaking to a room full of local nursing students. They're trying to get the word out about the work they do.
It brings me great pride knowing that what we're doing here in Abilene is being noticed across the nation, and people are reaching out to us to become a part of what we're doing here and try to emulate it. What seemed maybe so small at the beginning is growing bigger and bigger daily.
Abilene's just one example of how response teams can meet community needs. But these response teams shouldn't be applied with a one-size-fits-all approach. Abilene is situated in West Texas, and the racial demographics of the town are majority white. In some communities, a law enforcement response can be more triggering for people in crisis. A response team in a larger or more racially diverse city might be made up of different professionals, like nurses or social workers. These professionals might receive different training that helps them respond to situations relevant to their community. Ultimately, successful response teams are built to meet the unique needs of the communities they serve. We're back with Julie.
We've come to understand that different jurisdictions will have different challenges. But if in the next 5 years we are focusing on decriminalizing people with behavioral health issues and intervening with clinical services and not law enforcement and the criminal legal system, that will be a success.
I absolutely think this is a resource needed in any community.
Having officers trained to handle these situations, having medics, crisis workers available, you're less likely to have a violent outcome. You're less likely to have repeat cycles of crisis.
You know, if we don't do something to get in front of it, it's just going to get worse. We've seen an uptick in a lot of our calls, just people that just need to talk to somebody. You know, they don't necessarily know how or know why or know where to go to. Sometimes we get a call and it's just all they needed to was to talk to somebody.
That's Margie calling back. Hi, Margie.
Hey, where are you guys at in town?
You want us to come see you?
I'd love to see you guys.
Yeah, there she is.
Hi, Margie. How are you?
Hey, I'm great.
You look happy.
Yeah.
Your spirits are back.
Yeah, oh, yeah. Life is good.
Margie, today was the birthday of her son that has passed.
I have anxiety because I lost my son, and I was crying and in a meltdown, and they showed up at my house, thank God. They helped me. They got me into some outpatient counseling, and they've checked up on me regularly just to make sure things were going good. They just don't see and forget about you. They're constantly involved.
She always talks about how his favorite cake is a funfetti cake, and she makes him one every year, and she gives it away. And so we took her a funfetti cake for her to be able to eat instead of giving it away.
Bye.
Good day.
I will.
Enjoy your cake.
I will. I'll go home and I'll probably share it with the babies.
Of course you will.
Yeah. I'm down to 3 though. My 2 blue pits and my little black people.
Runs the house.
He thinks he does.
On the engines or the ladder trucks or even on the ambulances, you see the person calling 911. We treat them, take them to the ER. We know hypothetically they got better because we took them to the hospital. But getting to see them on a regular basis, seeing them get the new job that they wanted or getting into the class that they wanted to, or even just getting to talk to their parents again because they're stable enough, you know, that's a huge reward that we don't often get to see in our line of work.
It could be a death in the family, they lost their job, a divorce, anything that you could possibly think of to hit that crisis threshold. And what the team allows, it's a softer, more balanced approach. They know that on any given day, they've got 3 friends that are going to come see them.
We're going to be consistent, and we're going to keep knocking on your door until you realize that we're on your team and we're here to help you out.
We get to a point where we've built pretty good relationships with people. Just last month, we took one of our clients' husband a birthday cake, and he bawled. He broke down crying, and that, it just touches your heart a different way. He said he hasn't been given a birthday present in years. Seeing a 65, 70-year-old man just absolutely bawling over a piece of strawberry cake that you took him for $3.60. It kind of touches on your heart. And just being able to be that for someone.
To hear more stories like this, visit us at pewtrust.org/afterthefact. And if you have questions or feedback that you'd like to share, or you want to let us know what kind of stories you'd like to hear on this program, you can write us at podcasts@pewtrust.org. For the Pew Charitable Trusts, I'm Dan LeDuc, and this is After the Fact. If you or someone you know needs help, please call or text the 988 Suicide and Crisis Lifeline at 988, or chat with someone who can help at www.988lifeline.org by clicking on the chat button.